Good morning, good afternoon, and good evening. And we welcome everybody around the world to this important conversation. For those that didn't know, and I didn't know until a few minutes ago, it's Climate Week in New York City. And it's an event that brings together diverse audiences, communities, and decision makers to spotlight the climate crisis, as well as the innovative and collaborative ways we can mitigate and halt its circumstances. So it's timely, and it's also coincidental that we'll be in conversation this morning with Ruth McDermott-Levy. And Ruth is a professor and co-director at the Mid-Atlantic Centre for Children's Health and the Environment. Ruth is by trade, in the field of nursing, and you'll hear across the conversation today how she really has threaded through her interest and passion and curiosity about climate change, into the field of nursing. She teaches and researches about the intersection of human health and the environment. As you can imagine, Ruth has many awards. To mention two: Fulbright Scholar in Finland, where she worked with Finnish nurses to link climate change to health and address mitigation and adaptation strategies. And in 2020, Ruth was honoured with the Charlotte Brodie Award recipient for the nurse who exemplifies environmental nursing leadership. What was really interesting to me when I was prepping for this conversation was, and I talked with Ruth just earlier, saying, you are well before your time, Ruth. In 2016, Ruth published Health Concerns of Northeastern Pennsylvania Residents Living in an Unconventional Oil and Gas Development County. Now, across decades, Ruth has been publishing in the areas of the intersection between human health and environment, with a real focus on teaching nurses and nursing. So published the Advancing Gerontological Nursing Science in Climate Change, Integrating Climate Change in Nursing Curricula. I didn't know that existed. And more recently, The Nexus of Climate Change, COVID-19, and Environmental Justice on Child's Health. I think one of the fascinating comments Ruth made when we were talking with one another, and I've got it down here: I'm more than a person, I'm a mum. And in that gem, you can get some insights into the person that we're going to have the pleasure of talking with today. So welcome, Professor Dr. Ruth McDermott-Levy. Welcome to our Global Cafe.
Thank you, Jane. And thank you to everyone especially people for getting up so early. I thought 7 a.m. was early, but 5 a.m. Wow.
Yeah, we're very lucky. Ruth, there's much to talk about, in your field of study, but I really want to start and talk about what drew you to this area, because you were publishing, 2015 and before, in this area, and that wasn't so fashionable at that time. And it would have been very difficult to get anybody to actually be interested in that. So what is it that drew you to that?
Well, in 2008, I was the, the chairperson, I believe, I forget the title, for the Pennsylvania State Nurses Association for our Environmental Health Committee. And that's when fracking, the unconventional gas extraction, started in Pennsylvania. And Pennsylvania, for those of you who aren't familiar with my state, is an extraction state. We had the first oil well in the U.S. And in the 1800s, and then it's a big coal state, and now we're a big producer of natural gas. And the real quick story with natural gas is, for the most part, they're drilling right near where people live. And so, it's obvious that there were environmental health risks there. So in the committee, in my work with that, we did a lot of advocacy at the state level to try to protect people's health. unsuccessfully because money was driving, the gas extraction. And so, with that, as I kept trying to get people to listen, really, trying to get our policymakers to listen that, people are getting sick from this. And now we have the evidence that people are getting sick, children are getting leukemia, adults are, getting a variety of health impacts, neurological, respiratory, a variety of things. And so in my frustration, I kind of went upstream a little bit more of, what is the bigger picture and how can we get more people to listen? And so that drove me to climate change, because methane, which is natural gas, is a very potent greenhouse gas. And so, that I thought people would listen to that. You can see not so much success there either when we think about our policymakers, but I remain optimistic and keep pushing.
And we talked about this, the importance of generations, and we're not only advocating for current generations, but it's your children and your children's children. So talk a little bit about that and what your hopes are for the current generations.
Well, we've already, the greenhouse gases, as I'm sure you all know, remain in the atmosphere for as long as thousands of years. It depends on which gas you're talking about. But, and actually methane is shorter lived. So if we can go after that, we can really make a difference. But so we've already committed to some climate change, and we're all experiencing it. No matter where you are in the world, you're experiencing some environmental changes. So, but if we do reduce our greenhouse gases, and some of the evidence is saying we can actually even have a bigger impact than we thought, we can make things better for, our children and grandchildren, and then certainly their children. And so, I believe we have a responsibility to them. We know the science is there. We know that we can make a difference. And so, it's going to take all of us. We talked about our policymakers having different perspectives, different people that they answer to, and we need to make our voices clear to them, that they also answer to us and answer to future generations. So it is a different way of thinking about things. Some of that has driven me to start to think about Indigenous populations that do tend to have a broader perspective. I haven't done a whole lot in that area. I've done some reading, but and quite honestly, I don't believe I should be the one that does the work in that area. I think we need to support our Indigenous people to give them the voice to do that work.
So Ruth, you're a nurse by trade. So this intersection between nursing and climate change, can you unpack that? Why is it important?
Yeah, well, there are obvious health impacts with climate change. I mentioned the respiratory problems that occur with fracking, but we do see, poor air quality with climate change, that we would see more acute things, so increased hospitalizations for respiratory disease, cardiovascular disease, and certainly that impacts our older population. And we also see kind of more long-term problems with food security, housing security, and it's a disruptor. And so any of those things impact the health of groups of people. So among the things that I've been working on is trying to prepare nurses, as Jane mentioned, to be able to address those things from planning, for disaster sort of events, which we do pretty well on, globally on addressing disasters for the health sector, but there can be more kind of subtle things. For example, getting more people being admitted for a respiratory illness like COPD, chronic obstructive pulmonary disease, or children with asthma. So how do we, prepare people and prevent that? Do some education with the community, do education with healthcare providers. And then, and when we think about nursing, we tend to think about a hospital, but that's not the only place we practice. But also, how do we discharge somebody from the hospital being prepared so they don't come back. You know, we want to keep people healthy. So we've done some work around that too of, you know, how do we get healthcare providers to consider what are the risks in their community and then how to prepare for it. So it's not just disasters, it's how to live with this on a daily basis.
Mm. Look, I know we're jumping around a bit, but you talked about nurses and health and you know, how do we stop people from returning to hospital? I just want to take you to this recent article about the nexus of climate change, COVID, and environmental justice on children's health. You know, I'm really interested about that intersection and, you know, what you found in your work.
Well, it's kind of the same old story, right? That the most vulnerable are low-income populations, people of color, tend to be the most marginalized. And so that is the group that we need to really consider when we're thinking about these risks, and also help them have the voice to speak for their own communities of what they want. People know what's going on. They see the changes, they see the injustice. And we during COVID, certainly in the United States, it was really highlighted of the inequities that were out there. I'm a public health nurse, so it was like, yeah, we told you, we've been telling you that low income communities of color are the most vulnerable, and the data says that they don't do as well with health outcomes, and there's more illness in these populations. And so, it amplified that. COVID amplified those risks for communities. And so, again, as a healthcare provider, it is critical that we address these issues and that we verbalize that or share that with people making policy decisions, but then also help people have their voice and share with policymakers what their needs are.
You know, I struggle constantly, Ruth, you know, where I live downtown in Toronto, because it seems that every winter we have, you know, another increasing percentage of older people living on the street, you know, and, you know, that nexus between, I had shelter two years ago, and now I don't have shelter, and winters are even more brutal. So, you know, we can see that while social determinants of health, we've talked about it a lot, and Sir Michael Marmot's work on the commission was outstanding. But I'm struggling to understand whether governments are actually addressing some of the fundamentals of social determinants. You know, if you're born in poverty, will you die in poverty? And in many situations, you will. I mean, how do we address policymakers when we're really, when historically we know that it's the same problem that it was 10 years ago, but only bigger? How do you as an advocate do that?
Yeah, it is a major frustration, and climate change and the social determinants of health and all of these issues are really part of one big whole. It's not; these aren't separate issues, and it comes down to how we treat each other. I'm really convinced of how, you know, I was raised, and the conversation is changing, that if people were poor, it was their fault. They were doing something wrong, right? And if, you know, people are getting sick, well, it was all about human behavior. And one thing that COVID did is it did amplify these issues, and it changed the discussion a little bit of more structural determinants of health. Of what are those things that put people in that place. In the United States, we have an awful history of enslaving Black people, and then putting in barriers for our African American citizens in the United States, that they don't get the same opportunities that white people got for decades. And so, you know, how can you expect things to change overnight, right? And so they're the things that we need to deal with. And so, thinking, more globally, and I think of what is called planetary health. I don't know if you're familiar with that term, or it's worth a framework worth looking at, where it looks at the economics, the policies, the culture, and the environment. And so it's a more holistic perspective. And so I think that's the way we're teaching. That's actually in the United States, that's kind of our call of a way to teach nurses. It's in our the criteria for accreditation now. So that's a good thing. And so we need to keep pushing for that. And we need to help, again, looking at the United States, our communities of color and our low income communities, which are often because of policies that are in place, not what people have done, it's what people have done to them. We need to keep pushing to make that more equitable. And in doing that, again, with a planetary health view, thinking about the changes we make, how does that influence the environment? How does it influence, cultural things? And so what we're talking about is what's known as a wicked problem, right? That it's not easily solvable, and there are many factors that play a role. But again, thinking of indigenous populations, the seventh generation of often the decisions are made of how it will affect 7 generations down the road, and that's the work we have to do. That's the work we all have to do and push for.
Complex. As I mentioned, Shmuel is a regular person on our global cafes, and I'm going to ask your question, Shmuel. Ruth, how do governments and authorities support older adults in tackling the negative impacts of climate change? And I go back not so many years ago, to the heat in France, that it was oppressive and many thousands of at-risk individuals, older people, died. So can you see any shifts in the way that governments are, supporting at-risk communities?
It depends on money and political will, but locally, thinking in the U.S., what we have seen, especially when you're talking about extreme heat and the impact on older adults, because they definitely are at risk for extreme heat. We're starting to see in the U.S. we have a program called LIHEAP, and that is for low-income people to provide heat for them, right? If they can't afford that, we're starting to see the discussion of, and communities doing work around this, of providing air conditioning for older adults. We have cooling centers in different places, and certainly that's done around the world, where people can go to get cooled off for extreme heat days. And again, that it depends on where people live, on how they acclimate to heat. But really, when you think about an older adult, and when you think about some of the chronic diseases that they may be exposed to, and we may have people with functional issues where they can't get around as easily, they can't ambulate. We may have some cognitive issues. It's not the best plan to move someone somewhere else. And so some cities are starting to provide air conditioning in people's homes, which is actually ideal. That then they can be in their own home, they can have their medication, all of those challenges for somebody who is older, and again, can have some visual issues, hearing issues, a variety of things that can happen as we age. And so that's what is happening, but it's happening very slowly. And it's really awful that it takes these horrible events where people lose their lives when we know that can be, why do we wait to prove that this is a problem when we know heat kills people? And so again, those of you who work with older adults, if you can advocate for that. Again, we don't need any more data for that. We know heat kills. We know air pollution kills. We don't need any. I'm more. Research is important, but we need to use what we already know to advocate.
So, and we talked about this, this balance between research and advocacy, and I made the bold statement that not all academics actually know how to advocate. They're really good at what they do. So, and you're very clear about using the evidence to advocate. I just want to touch on the work that you're doing online. You teach online now, I understand, and talk with us about the teaching in, I believe it's Nigeria. Is that correct?
Yeah, I teach, I don't know if we have academics on the line here, but I teach what's known as a COIL, and that is a cooperative online international learning. That's what COIL stands for. And it is a course, it's climate change and human health, and it is a course taught between a medical school in Nigeria, a school of nursing and public health in Finland, a school of public health in India, and then the US, a school of nursing at Villanova, where I am. And so if you're interested in doing it, you can do it if you're at a university fairly inexpensively. So I would encourage you to consider that. There's a lot of value to doing what we're doing. Many of us assume India, they have problems, and Finland's doing fine because it's in the north. They're not doing so fine, Finland. They have issues as well related to climate change. And so the value of it for thinking again of the future are these healthcare providers or future healthcare providers who are in the same online classroom, working together, learning about what is happening globally related to climate change. And it has kind of changed hearts and minds of, wait, this is a global issue. It's not just an issue for, lower income countries. And my mentioning of encouraging air conditioning for older adults, my Nigerian colleague goes, wait a minute, what are you doing? Like you're creating more greenhouse gases. And yes and no, we have much more efficient air conditioners, and we can think about where our energy sources are coming from. But that again is a Nigerian perspective. And I was saying, but you don't have, we have a lot of snow where I am, and then we have these really hot days. And so, we don't acclimate as well as you would in Nigeria. You're more accustomed to what to do. So again, learning that the nuances of each country and what is going on.
It's very situational specific, because often when 30 degrees in Toronto, and we get the heat warnings, and both my husband and I go, 30 degrees? Coming from Western Australia, where, 30 degrees is on the low side for summer,
Mm-hmm.
You do acclimate in different ways, even though you've been here for 20 years. So it's,
Right.
And that's where policy has to be very prescriptive at a situational level. And I'm not sure that we're there yet. You mentioned, your colleagues in Nigeria, and, I'm always interested as to, when we have these global events and we have the leaders stand up and say, we advocate for this and we're giving you this much money and that, at what level do we actually get to it, the national or the local, and really determine what kind of policies will protect the current generation and future? I mean, do you see that there's a cascading effect, or does something happen between up here and down here where I'm sitting?
That my Nigerian colleagues could probably speak to that better than I could for what's happening in Nigeria. I think it does depend on, the structure of, whatever country or whatever region. And, as you pointed out, if we can keep it more locally, those plans and policies, that's ideal. One of my frustrations among many is that we have these demonstration projects, right? Like we have things, we get funding and we can do a demonstration project, but when the funding goes away, the project goes away. And so again, we need to think more long-term of how can we build in sustainability of keeping people safe and healthy, and not relying so much on, these grants and things. And that can happen more at the local level than it can at national.
Yeah, look, I have the same frustration with pilot projects in models of aged care. They come and go and millions spent, but there is no sustainability.
Right. And the people who are part of it suffer. I mean, yes, we're going to do all these things for you. The money's gone. Well, then so are we. And that it's just really wrong.
Yes, it is. Look, I encourage all of our cafe attendees for questions for Ruth. So pop them in the chat box. But I want to go back and talk with you about measuring the impact of climate change policy and the work. We'll put the policy to one side for a minute, but how can you measure the impact of climate change in the nursing curriculum? What are you going to see in the generation of nurses coming through?
Well, that's a great question. Well, a couple kind of easy ways to measure the impact is we do have, as far as like a nursing student, and this is pretty much global, we do have a license, right? And so there's typically in the United States and Canada and many other countries, there's typically an exam. So one of the things that we are trying to do, and I know they're working on it in medicine as well, and their medicine's having a little bit easier time to do this, is we're trying to get climate questions on the exam. So that, again, to measure that nurses are prepared. The nursing board in the United States has been a little slow to do that, but we keep reminding them, okay, we just had wildfires in the West. We've just had, and on the East Coast of the United States this spring, we had wildfire smoke that, we've never had before. So these things do affect health. So that's one way to measure it. The other way it would be, kind of, again, looking at numbers. There's a drive right now, and this also is a international initiative. The IDC codes, the codes, we code medical diagnosis, and we code often symptoms too. And now there are some codes that are related to the environment, such as air quality, such as heat, and the social determinants of health. Wow. That's exciting news for those of us in that area. So there's initiative to work on getting providers to code, okay, Mrs. Smith was, admitted for dehydration and a cardiac problem. We'll code that. That's typical, like the medical piece, but then to code extreme heat.
Yeah.
So, so the challenge with this is to educate the providers that this is out there, and there's a tool to do that. And I'm going to see if I can share it, and I will send it to you if I get permission. I think I'll get permission to share it. But that tool's out there. And then the challenge is our healthcare providers, and this is a global issue, are stretched to the limit. Yeah. Right. I mean, it's post-COVID. We lost a lot of people in the healthcare sector because of the challenges of COVID. We don't educate enough people of a variety of reasons. And so oftentimes our providers don't have the time to do all of that. And so that's what we're trying to get that in place and educate them that is another way to say, okay, this, it's actually a quick way, because most health systems have some electronic means to do that. We can quick pull those data together, but then we can again present to the healthcare provider, the policymakers, this is an issue. I mean, we're seeing it, and it costs the nation money. No matter, in the U.S. we have the private system, but a lot of places have a more socialized system that it's costing money, because again, money drives things.
Yes. Look, we've got quite a few questions, so I will move on to them quickly. So I'm going to Dr. Rao first. and then Donna Gallenstein. So, Asha, would you like to come forward and ask Ruth your question?
Good evening, Ms. Jane and Dr. Ruth. I just heard you talking about Ms. Ruth being in India. In India, usually the weather is not very bad except the winters, and that too also in few states. So what was your experience and what do you suggest? Because nursing and policymakers, government's decision and policymakers, they are both poles apart. Nursing staff can only help the patients. What about the policies which will help them?
Thank you, Aisha. I have not been to India. I've been to India virtually through the classroom, but I have not physically been there. But I, have taught this course for 4 years, and I work closely with our Indian colleagues. And my understanding is, because I did do a session with the nurse administrators in India on climate, but my understanding is, compared to the United States, the nurses don't have as strong of a voice as they do in India, is what I've been led to believe. And but nurses, we are the largest group of health professionals globally. So there are more nurses in India than there are physicians. So, they can use that power. But I also think they should join together with other health providers, because the physicians and the nurses and, respiratory therapists, they all want the same thing for the patient. So, that, would be my recommendation for working with policymakers, that they all join together. There is strong leadership in India for climate and health. There's very strong leadership. And if you're interested, I can, you could send me an email and I can connect you with the people that are doing that. They're working at the WHO level with World Health Organization. So Wonderful. You've got some great people doing some really good work, really smart people doing good work. Okay. And the important thing about India is our Indian students are amazing. I love the insights that they provide.
Okay, so thanks, Asha. I'll go to Donna and then me. So Donna Gallenstein, are you with us?
Hi, yes, I am. Hi, I'm from Tampa, Florida. Do you think the climate change has increased our cancer numbers? I work at a major cancer institute here, and we're seeing a lot more younger people and a lot of more elderly people with cancers that typically we wouldn't have seen before.
That is a great question, because I agree. I mean, I have friends with horrible cancers that I'm like, wait, what's happening? And we've seen much more pancreatic cancer that we haven't seen before. So it's quite possible. I haven't seen anything about that. But if you think about, again, poor air quality and more particulates, the risk with cancer, and then, our water quality has gotten disrupted and issues with that. So it would make sense, but I haven't seen anything about that. But I'm gonna look that up after today's session. But it does make sense.
Okay, thanks, Ruth. Welcome back, Dr. Bill Smith.
Well, thank you. It's good to be with you this morning, Jane. Dr. Ruth, your presentation is excellent. I've enjoyed a long relationship with Villanova and know what an outstanding nursing program its graduates are presently working on. Peter has to be extremely proud of this program.
Bill, it's a bit patchy.
Oh, I'm sorry.
No, you're good there.
Okay, I won't move. Anyway, Villanova has included many good nurses in working in extreme intensive care programs, global aging CDC issues, and just really has been, I think, a trailblazer in training our nurses for tomorrow. Nurse graduates in the New York hospitals and long-term care facilities have been well received. How do you replicate that program for other nursing programs around the country?
Okay, so Ruth, Dr. Bill was talking about the outstanding nursing program in Villanova, and that those nurses, have done some amazing work in CDC and globally. And how do you actually replicate that work? That kind of sense of purpose, around the world, but acting locally.
Well, first of all, thank you so much for acknowledging our school. We've all given a lot of blood, sweat, and tears to educate our future nurses. Well, first of all, I'm going to say Villanova is a mission-driven university, and so we really do highlight social justice and equity, and actually we just added a course on justice throughout the entire university, but it's related to each discipline. So the students will have a course on justice related to health and nursing. And I think the other question was some of the global initiatives that we do. Okay, so one of the things that we do, and I know other schools do this, so I want to acknowledge that other schools are doing a really good job as well. But one of the things is we're really working on giving the voice to the community for our global work, and letting the community lead of what it is they need, and then looking at how we can support them. So we do that locally and we do it internationally as well. And this becomes a problem when we think about the money, because sometimes funders like, yeah, but I want you to, worry about insects, mosquitoes. And when the community is really like, what we need is clean water. And so we try to help them put that together. So I think other schools and other places are doing that. And I do think, again, acknowledging the knowledge and wisdom of community members. I did work in Nicaragua for about 5 years, back and forth. I was stationed in the United States, but I go to Nicaragua quite a bit. And it was in the mountains of Nicaragua, very remote. And one of the things that came to me was that the people most people only had the equivalent of a 4th grade education because of the wars and things. But I could not survive in those mountains for more than 48 hours. I knew I couldn't. I didn't have those skills, but the people in those communities did. And so relying on that wisdom, and that's one of the things that we really do highlight with our students. I think, and that doesn't cost anything, right? It's not, you don't need special equipment or anything. You just need kind of good common sense. So that's what we highlight, and that's I think that can easily be replicated around, sharing knowledge, sharing the wisdom of people who live in challenging situations, and then the knowledge that academia has, and we don't have all the answers either. So if we can come together, I think we can be very powerful.
Yeah, I think the first sentence about being mission driven is so critically important, and so many institutions, organizations, providers fail to understand, that a mission is actually critically important because it underpins the values and beliefs, of that organization. So I think it was a really important conversation. Ruth, could you just repeat what COIL stands for? Mercedes would like to know.
Sure. It is Cooperative Online International Learning.
Okay. Cooperative Online International Learning.
Yes. And I have said we put this course together with safety pins and Scotch tape. I mean, because we used the existing online platform that we had at the university, and I carried on a bit to make sure that our partnering schools could get into our platform. That took a little bit of work, but I pushed through to get that. And they don't pay anything. The students from India pay their Indian tuition, and the students from Villanova pay their Villanova tuition, and the students from Nigeria pay to their university. So they're all students in their own universities, but taking a course using our platform, and they're all together in the same online asynchronous classroom. We do have 4 sessions where we meet together at 7 a.m.
Okay.
So.
So we can't join it then, Ruth?
No, but I would happily give you the recipe.
I think
that you could reproduce it. And that was
right.
when we started this course, that was our intention, was to share it and reproduce it.
Okay.
Anybody else could do it.
All right. So we're interested. Okay. So
Great.
We'll look forward to it. Ashni, you had a question for Ruth.
Yep. Sorry. Hi, Ruth. I just wanted to know, how does climate change specifically affect older adults in terms of their health and well-being?
A lot. The physical impacts are kind of, I guess, the most telling. Older adults, as we age, our ability to manage heat is not as good, our ability to thermoregulate. And so, as we mentioned, heat can be really challenging for an older adult. Often, as we age, we have chronic diseases. And so people are managed with medication. And so some of those medications make people much more sensitive to heat. Some of the medications used for blood pressure, some of the medications, those water pills or diuretics, can be problematic. And then also lithium. So people that may have some bipolar disorder may be an issue. So that's some of the things. And then thinking about extreme weather events and where people may have to be moved from their home. We also are seeing climate refugees, where people have to move completely from their home, where it's not habitable anymore. And so if you think about an older person that has lived their whole life in a certain area and now is being moved somewhere, that can be a problem. And so we can get some issues related to confusion or dementia, for older adults, depending again, as older adults, it's a whole spectrum from, somebody that's 94 out playing golf every day and totally fine to somebody who needs a lot of support. And so, depending where people are along that spectrum. And the other thing that we're finally starting to mention more and more is mental health. And so it can be very challenging, climate anxiety, depression with loss of home and loss of, the way you've lived your life. So there can be problems there. We had on the East Coast, when we had all that smoke, for days on end, I was actually even getting rather blue, because I thrive on being outside, and I couldn't, ride my bike like I typically do. So, these changes can be really challenging. And then the other thing is our food. We are going to see, no matter where we are, we're going to see issues of food security. So, people not being able to get the right nutrition. There's some science to say in the presence of high CO2, our plant-based foods, such as like legumes and rice, and have a higher level of carbohydrate and lower amount of protein. And so when you think about what people eat around the world, that can be problematic. And then, I could go on and on about all the risks, but they're kind of the big ones.
Well, it's really, I've never thought about, the composition of food and how that may change or is changing with climate change. Just another question about your work. I know that you and your colleagues have examined climate change adaptation of community-based organizations. Can you talk a little bit about that?
Yeah, we used a social capital lens when when we looked at that, and so for those of you who aren't familiar with that, social capital is really the connection between organizations, and like how connected you are to other organizations that may support you. And so that's what we looked at. And we were lucky enough to have access to the area agencies on aging. And that's kind of a structure in the United States. And so we just looked at one single state because we were piloting our tool and wanted to see how it worked out. But so we looked at Pennsylvania, which we're the 5th largest group of older adults, the state with the 5th largest number of older adults in the country. So it was kind of a good state to look at. What we found was, so area agencies on aging provide services to older adults in the community. And they have, the equivalent of like senior centers of where people can go and where they support them. And so we talked to the directors and asked, kind of what kind of connections they have. What we found is that they're prepared for disasters. And when we think about climate change, we also often think about disasters. But as I said earlier, climate change is happening now and all day long. So they weren't really prepared for addressing some of the health issues that I just described. And so, what on days that the air quality is poor, what could they expect from their clients? And how could they manage that? So that's one thing that they weren't prepared for or addressing. And then the other thing is, because the funding is through the state and then at the county level, so it's mostly local county funding, how they only really worked with county agencies and didn't think of connecting with kind of the bigger picture. In the United States, we have 10 regions of our federal agencies. So there's federal agencies around the country to support regional issues. And so that's really, and that's actually where a lot of the money is going right now for this. So if they can connect with that we believe that would help get them the services that they need to support our older adults in the community.
Right.
They're the things. And so from there, we're going to start doing some education with the AAAs, the area agencies on aging.
So you really have pulled through evidence into action at a community level and talked
Right.
about this local. One last question before, I introduce next week's topic. You talk about the healing impact of nature.
Mm-hmm.
How can current and future generations be hopeful when the evidence suggests such dire consequences of climate change?
I'm trying to link that with the healing power of nature. Let me just talk about the healing power of nature, and I'll try to get into hope. I do believe hope exists. I really do. But there is evidence to say that when we're out in nature and in the forest, that our heart rate is decreased, our blood pressure is decreased. In Japan, they do forest bathing, where people go and intentionally spend time in nature. And so there are benefits for people to be in nature, absolutely, and our older adults to be in nature as much as possible. Even if they're digging in the soil and gardening. I actually worked on a project with students where we had raised beds, so like raised up, to the waist, so that people could stand or be in a wheelchair and grow food for older adults. So there are a lot of innovations and simple things that are possible. So I think that connection of when people feel more connected to nature makes you want to preserve it and makes you see the value of it. So I think that is the hope. And I do, we need clean air, we need clean water. So all of those things that are provided for us can help people see the importance of it. And I think, again, being out in nature gives people hope. The hope for the future is we have a history of always getting like right to the end, right to that cliff, and then going, okay, we'll fix it. So I think we are at the cliff, and I do think people are listening now. And I do think people are ready to fix it. You mentioned I've been at this for a while. Early on, people thought I was a little crazy, and that's okay. And perhaps that's true. But, people are now ready. They see the impact. You're muted, Jane.
I've been around for a fair while now, and I can remember when cell phones didn't exist. And there's something about, perhaps we just need to return to nature to know the value of nature and then be advocates. Mm-hmm. Because I sit on public transport, and people don't sit now. They're on their phones. And they walk when they're on their phones, and they're cycling and they're on their phones, and so perhaps there's something about, getting to that door and saying, let's put the phones and everything down and feel and experience the gloriousness of nature.
Right.
And then we can be stronger advocates. So I'm going to leave you there for just a moment, and I'm going to introduce our next week's conversation. So, some of you on our Global Cafe today may remember Dr. Gulnara Minna-Galeva. Gulnara was involved in the very first part of the development of the age-friendly cities and communities and worked a great deal. She currently lives in Russia, and she's going to be with us next week. First time for a long time she's going to be here in a global event. So really encourage you to come along and listen to the insights and wisdom of Gulnara next week on the changing perception of older people. And that's really right at the nexus of the International Day of Older Persons. So come join with us next week. I hope that I'm going to be able to moderate this really important event for us and also for Gulnara. So thank you very much, Ashni. Ruth, I've learnt so much in this hour listening and talking with you, so that I'm going to turn my phone off this afternoon, and I'm going to go for a walk in nature and start learning about the importance of advocating, around climate change. I know that there's a number of events going on in New York, and also the NGO Committee on Aging in Geneva are putting on a side event on climate change. But it's a field that I think people in this area of aging are only just stepping into. Even though some may have been in for years, this is just the tip of the iceberg. So thank you very much for being with us today. And I'd like to ask you to give us some closing remarks before we close down today.
Well, I do think, as I said, I don't think all is lost. And I think there's opportunity in addressing many of these issues, that we will have a healthier environment. And I do encourage you to all get out and walk and ride your bike or whatever. Active transportation is good for our physical and mental health.
Well, look, thank you very much, Ruth, Dr. Ruth McDermott-Levy. Keep up the leadership. There's a lot more people that are following you now after this Global Cafe. So thank you, everybody. Stay safe, stay well, and I look forward to being with you next week.